things. We have David Hall, who has just felt a migraine, is going to go on home, but he is going to be on a subcommittee with Cassie on looking at CJ recommendations that may be relevant to the mission that you guys have. Are there anybody else from the task force? Hill came and the prosecutor will help them out and be sort of the lead staff for that group. So we have some people interested. Are there others of you that would like to be on that? It's probably maybe 2 meetings. Okay, let me just make sure I get this right. Sylvia, Flora.
By CJ, you mean community justice?
Criminal justice,
Criminal
yeah.
justice,
yeah.
Okay.
Sylvia, Flora, David, Cassie, anybody else? I think that's a good team. So again, you guys will come back with some ideas in probably October, early mid-October time frame for this group. Thank you. And Hill will be in touch about getting you guys all together. Thank you for that. Another thing, there may be other questions around criminal justice issues, so one of the things I will do after this meeting is just send you all an email. If there's some question you would like to have asked but didn't have a chance to ask it in the session today, since we did have a heck of a lot of time, send me back what your question is. I'll collate them, I'll get them out to the gang, and we'll see if they can get us some answers back for everybody at a future meeting. So watch for an email from me on that, if you would. Okay, that takes us forward to the second panel, which is around outreach. And this is going to be pretty different from the last panel. It's going to be a free-for-all. I have no idea how it's going to go. So thank you for remembering the ground rules in your fish, if you need to. And on outreach, we're describing this pretty broadly. I mean, again, the analogy I use, which I wish I could tell you I made it up, but I didn't, for outreach, it's sort of, I think of it as getting people into a lifeboat rather than just moving the chairs around on the deck on the Titanic. Get them into a lifeboat. So the outreach is having a lifeboat and getting the people to get into the boat with you. So our goal today for this discussion is to try to learn more about who is hosting or manning these lifeboats here in Everett in the commercial areas, who is doing the outreach. What does it look like? What's the range of services being provided? What's working and what's not working? And what ideas do folks have for improvement? And I sent you all out this discussion guide that addressed these issues. I'm just going to stick it up here. And so the first thing I wanted to do while I'm sticking this, I want folks to raise their hands. If you are somebody that provides outreach services to individuals in need or hosts a facility where I'm sorry, what? Yeah, we will. Yes, we will do that. Sorry, yes. Who provides outreach services to people in the community or hosts a facility where those services occur now, like a church feeding program, or the hospital, maybe there's some outreach. Can you just raise your hand if you are involved in outreach services in some way? Okay, so a lot of folks. So before we get into that, the first part of our discussion is going to be hearing from Wendy Grove, who is the co-founder of the Recovery Cafe Project. And we have a short video which describes this project. Where did Wendy go? Oh, there she is. So Wendy, thank you for being here today. Tell us a little bit about the project, and then we're going to roll a short video for y'all.
Good afternoon. We are targeted to open in October in downtown Everett, and we are a day center with the mission of cycling people out of homelessness and stabilizing their lives. And with that said, we are a little behind, I think, Karen, right? So the video actually does a great job of explaining our program, and if you would like more questions answered, I will certainly can be available. Thank you.
This is our community.
Yours and mine.
A community full of life.
Drug addiction.
And mental health challenges.
Community members in need of a hand up.
Some you know.
Some are just nameless faces in the crowd.
For us, as a society, we're afraid. People seem frightened about that behavior, frightened about the folks walking through the downtown corridor or walking in residential areas. And so the first thing we think of is we call the police.
The traditional model is someone begins to struggle, maybe they stop taking their mental health medication, they start self-medicating with alcohol, things just go downhill quickly.
Law enforcement responds, and those folks end up in a jail facility for which they don't get help.
We do see a lot of recidivism that comes, people kind of on a revolving door kind of thing into the county system, into our emergency rooms in the hospitals being used for detox, which is incredibly expensive.
If a person does not have a way to stabilize in the recovery from mental health and addiction, then all the other things they're working on come unraveled. Employment, housing, health, relationships, it all comes unraveled if a person doesn't have the support they need to continue in some kind of recovery.
If you can get somebody with a mental illness or somebody with an addiction to engage in an environment that is alcohol drug-free, that is supporting their recovery, then what you're going to get is individuals who are not going to be getting in trouble with the law, who are not going to be going out and drinking and drugging and burglarizing or ending up in jail. I mean, it's all about having a continuum of activities, and Recovery Cafe is part of that continuum.
I would view the Recovery Cafe community as foundational. People need to belong to community. And then I would say that the other programs supplement being a part of a healing community.
It's really not a program, it's more of a resource. We're not going to have a starting point and an end point like most programs do, where this is going to be an ongoing resource for the community.
We're not going to offer treatment, but we want to be aware of all the treatment facilities that are available so that if someone needs that, we can help them access the information to get there.
It's a complement, if you will, to the more formalized treatment services that are out there.
A lot of our members have a case manager, they have someone who does counseling. They go there once a month. They come here the other 29 days of the month to practice those new skills and to be in community.
In order to become a member of Recovery Cafe, you have to make 3 commitments. 1, you have to be clean and sober for 24 hours. That takes work. 2, you commit to being a participant in a recovery circle, which means you have to give and receive feedback. That takes work. And 3rd, every person commits to being a contributor to the community.
Recovery is active participation in the process, where someone embraces the things that they need to do to transform their lives and make lasting change.
It is a community where people come to know that they are loved and that their life matters. I asked one gentleman who had relapsed, and the very next day he was on the steps of Recovery Cafe before we even opened. And I said, you know, the last time you relapsed, if I recall, you stayed out 15 years. Why this time did you stay out less than 24 hours? And he said, because it's the first time someone cared whether I got back into recovery. That is the ingredient that makes this place different.
Yeah, we can clap, yes. That's good. That's pretty cool. We have movie stars here in the room with us, too. Thank you. So Wendy, can you remind the group when you guys are scheduled to open and where it's the target is, and if folks want to help, what should they do?
This is in October, this October, which is tomorrow, actually. So we're preparing the site right now, and we are having our first fundraising breakfast in mid-October.
Excellent. Ed, you have a question? Comment?
So I understand 24 hours drug-free, drug and alcohol-free to get in to become a member. What happens when there are relapses?
They always have to be 24 hours drug and alcohol-free when they come in. So if it was a current member and they relapsed, if they were currently 24 hours drug and alcohol-free, they would be welcomed back, because we want that barrier low, because the sooner that they can get back into recovery, the better.
Renee?
Couple questions. Where is this located?
We're going to start in the daylight basement of the Everett United Church of Christ on Rockefeller and Everett Avenue.
Rockefeller and Everett. And how do people get referred there?
We actually are passing out our information to agencies right now, and so they will be actually telling their folks where we're at.
And is this sponsored by the city or the county, or you're raising funds from the public, or how does it get funded?
We did get a grant from DSHS to produce the video, and we're pursuing grants, and the fundraising breakfast is for the public.
Ed, thank you.
Will there be showers? Will there be food? What other needs will be met?
It is basically a community, as you saw in the video, and we will be serving lunch every day. Currently, the Seattle Recovery Cafe serves breakfast, or lunch and dinner, and they're open 12 to 6:30. We're going to start out with lunch and then expand as we grow. There are classes, there are art classes, yoga classes, walking club, in order to engage them in community as well.
Sylvia.
What is the capacity of the facility?
We're hoping that we can serve 80 to 100 every day. Probably not on day one.
Chief.
Wendy, do I understand correctly from a law enforcement perspective that this may be one of these other alternatives or options that may exist as long as they meet the criteria, where if our officers encounter somebody on the street, they meet the criteria, it's not somebody that we believe booking them into jail is the appropriate response, where we can either direct them or potentially transport them to that facility during the time you're open?
Right, and we're open 12 to 4:30 in the beginning, and it is a membership-based program. They're free to be a guest for a day, and if it's a good fit for them, they can come back to an orientation, and we sign them up for a required peer support group, and then they are members. So what I would hope is that we could be a resource even if they couldn't come at the time you needed to bring them there.
How do you document the 24-hour clean status?
It's behavior-based. So since we're based on respect, when people come in, if there are some indications that maybe they're slurring their speech, we'll have a conversation. We'll sit down, and because there actually are a lot of people that come to us when we were in Seattle from Harborview, and they had just been given mental health medications which present as not being drug and alcohol free. And so we'd have a conversation, and many times those folks actually would be on medications, and they said, hey, I just want to go sit in the corner. And so it's all behavior based. If it's not a safe behavior for our spot, then they're not going to be able to stay. But it's not, there's no testing.
Okay, Winnie, go ahead.
I noticed that in the video there were, sorry. I noticed in the video that there was what appeared to be a family group. Can people bring their families with them to this?
They do sometimes, but it was infrequent in Seattle. We do have some people who have sexual offenses, and they are responsible for their own behavior. So we try to actually let them know if there's going to be a child in the cafe, and we let them handle it.
Thank you.
Okay. I'm sorry. Go ahead, Chief.
One last question that I had. The location in Seattle, is it located in the downtown area? Is it located in a residential area?
It's in the Denny Triangle. It used to be downtown, but the members actually didn't want to be downtown because they didn't want to be walking past people who are using currently. They wanted to be apart a little bit from that.
Okay, and as far as the location that you guys have selected here, your experience in Seattle, any issues or concerns with spillover of issues or problems within the neighborhoods and things like that? Or not really
It's still a fairly urban setting in Seattle, so yeah.
Okay, thank you.
But there is a Whole Foods 2 blocks away. Thank you very much.
That's urban.
I'm sorry, I have one more question. How many staff will you have on site during opening hours? And if there's a mix of adults and children, I was just curious on, the level of supervision and whatnot.
We'll have 3 paid floor managers on staff at all times, and there will be volunteers as well, and the admin staff as well.
Thank you.
Okay. Thank you, Wendy. And good luck with your fundraising breakfast and the opening in October. So we wanted to spend the last time that we have here trying to get a little bit more out on the table about who's doing what around outreach and where you see the gaps, what's working, what are your ideas for improvement if you are engaged in outreach, or even if you're not engaged in outreach, what would you like to see happen that you think is not happening enough or is not happening at all here in town. So I'd like to start with just a quick roundtable, if possible, around that first question about the type of outreach services that are being provided, whether you're hosting a facility where other folks are coming in and saying, hey, I can get you hooked up with some housing or some medical treatment, can I help you? Or if people are coming into your facility directly and asking for those services. So I'm just going to maybe go around the table, and if you do outreach when it comes to you, can you raise your hand and tell us briefly what kind of services you are providing, okay? Do folks understand this? We're just going to try to do a quick informational round here. Okay. Chief, what would you say around outreach?
Well, I think, our major role in the outreach, is our officers on the street and in the interactions that they have when responding to calls or proactively going out and making contacts, and as you've heard already today, trying to line up those individuals that with some of those services that are available. And I think one of the biggest challenges that we face in law enforcement right now is that there may be a lot of resources out there that we could be hooking some of these individuals into, but we just don't know about them. And so that certainly from the police perspective is something that I'm really hoping to learn about here and develop some of those relationships, because as it's been mentioned here, this diversion at the various different levels, I really think that law enforcement diversion, whenever possible, when appropriate, is something that we're very, very much interested in, and we recognize that with some of the issues that we're dealing with, that we're not going to be able to just arrest our way out of some of these issues. So, but we're primarily dealing with on the street, bringing them, whether it's to a detox facility, to the hospital, to the triage center, Compass Health. Those are some of the resources that we're looking at, and that's our primary role, is generally trying to stabilize the situation and then transport them to a stable setting where they can hopefully start to get some treatment.
Great. I'm going to skip over and come back because I think Bob may have to leave early today, so I wanted to let him speak to the outreach that you do.
Thank you. So Volunteers of America, we do not do outreach in the part of the city we're talking about, but we do one thing, 2 things that have an impact on people who are moving around chronically homeless moving around the core area. Our main headquarters at California and Broadway, our doors are open and people will come in. We have a receptionist who answers questions, gives information, connects them to 211 information and referral. And we have a telephone, and the telephone may be even more important to individuals than the information. And so that does cause folks to come into our area and have an impact on what's going on downtown. I would just add one thing in the strengths and things that we do well. I realize I'm jumping over here, but we run a 24-hour call center, actually two of them. One is 211, which is information about human services that are available. They only, you or first responders, other folks who want information only have to dial 211 to get to that. And it is a direct link to mental health counseling. And for first responders, we can dispatch a mental health professional to a site that you might be at if you have a situation and you wonder whether or not you should this person has a mental health issue and needs to be transported. Again, 24/7.
Interesting. Thank you. Thank you, Bob. So I'm going to come back here. Sheriff, anything you would want to add to sort of complement what Chief Templeman said?
Good evening, everybody. I'm Major Tony Aston. I work over at the Snohomish County Corrections. I'm sitting in for Sheriff Trineri today. And so our outreach is I house 24/7 and feed over 900 personnel a day.
In reach, isn't it?
Yeah, they reached us. So not only do we house and feed them, we also provide mental health. We also provide medical. I provide dental. And so their safety is under our command 24/7 a day, and jail transition services are extremely important to Sheriff Trineri and all of our command. We're part of a lot of the different projects going on out here to ensure that they're getting, prior to being booked into the jail, we're looking for the outreaches that they need to be placed into. There are too many personnel, unfortunately, that come to the correctional facility that they don't belong there. And it's real important for us to be part of this, to make sure that we're getting them in the right direction they are, and at least if they have committed the crime that we need to get them into that facility, we need to meet them at the front door, get them the information, get them connected with the personnel through the community that are going to be able to sustain their help. And so as we get them into a release program, we can hand walk them practically to the help they're going to need. So as far as outreach, it's a multifaceted, multi-tiered project with us, so thank you.
Thank you. Linda, I know you've got some services to share.
Manor provides some treatment inside the jail, and then we do some transitional services. So I want you to know that this fellow over here in the red shirt, he's my outreach guy. So if you need things, don't come to me. Go to Jim Upton, and he's not the one running for sheriff. And Jim's responsible for not only our transitional housing, where we take people that are either coming out of involuntary commitment or coming out of the jail. They have to engage in treatment. We don't take people that are just needing a living place. And we also, what was that? I'm a little drifty. Oh, and we have a navigator program that's funded by the county, where there are a number of people who are very challenged when they're drug affected, and when you give them a lot of barriers they have to get through to get into treatment, they have difficulty. So we have a staff that are specialized in serving folks that maybe they've got medical conditions, or maybe they need a TB test and they're not on a medical card, and they can't get to residential treatment if they don't have their TB test. And so we try to, if you have someone that you're having difficulty getting them in, you can call our number and ask for her name's Tammy, or Jim does some of this. And they will work with the people that are really needing a lot of assistance to get through the system. And then we have a lot of other programs too, but those are ones that we do more outreach on.
If you had an ETA for your next detox bed facility, what year would you say you're hoping it will open?
Well, I'm just trying to put in an offer on a property.
That's exciting.
And hopefully, as Ken said, we can get it going in 2015. We have quite a bit of interest and support. We haven't converted that to the exact dollar signs, but But because today most people are funded under Medicaid, the low income, that we're hoping that we can get that going down in the South County.
Thank you. Does the school district have any outreach that you can think of, Chris, that you could share with us? That's really odd. For somebody who's coming in as an alternate, that may be above and beyond the call, but thank you.
That's okay. Other than we serve all the children affected by all of the mental health issues that I've heard about today. And when you put children that are affected by either family mental health or situational mental health because they are in a homeless situation, as you can imagine, behavior issues often occur. And so this year we, with the special ed, and I have the special ed services for the school district, but with special ed and general ed, we're doing a year-long program with the University of Washington talking about relational behavior with our children, and we will be having parent nights that will be community available at the Community Resource Center for folks to come in and learn about how to help children with behavior issues. And I think that we have found that that seems to be a big problem.
That's really interesting.
Cassie.
So Cocoon House does intensive street outreach to all corners of Snohomish County, including the downtown Everett corridors that we're talking about. We go out in teams of 2. We go out in different times of day. Sometimes it's early morning, sometimes it's late at night, sometimes it's the middle of the night, although that's rare because I always am concerned with staff safety. Again, that's always in teams of 2. We have a drop-in center that's open 7 days a week, 2 to 7, that provides showers, laundry, basic needs. We have a partnership with Catholic Community Services that provides drug and alcohol counseling. We have a partnership with Compass Health that provides mental health counseling for the population that we're working with. Those are all funded by Snohomish County, and some federal dollars as well as private dollars. We partner with law enforcement as much as possible. Sometimes I send teams of staff to law enforcement to help educate on the resources that are available. We're working with Arlington Police Department up in Arlington to do ride-alongs, and we're certainly willing to do that here in Everett as well. And we have a 24/7 number. I'll pass this around. So we can respond 24/7 to youth and young adults if there is somebody who is on the street that is needing housing or services. We have a hotline that you can call, and we will respond within 45 minutes and pick up that youth and transport them to our emergency shelter or transport them home. If it's a young adult, we do not have housing currently available due to licensing requirements that won't allow us to house kids because there's magic that happens when they turn 18. But we can bring them to the gospel mission as well. And I'll leave it, that's the services provided, and I'll hold off on the rest until everyone else gets a chance.
Thank you. Ed.
Housing Hope does not do outreach. We support all the agencies that do outreach and provide housing and other resources for them at 21 locations scattered throughout the county.
So others come into your facilities and provide service, or you refer folks in your facilities to them?
We provide housing and supportive services in our facilities for those who have done outreach and refer them into our facilities.
Okay, thank you. Winnie.
Hi, I work with Lutheran Community Services Northwest, and specifically with South Everett Neighborhood Center, Familias Unidas, and the Family Support Center of South Snohomish County. And so I don't know if you would describe what we do as outreach, but because we are family support centers, individuals and families come to us because they need shelter, because they need food, because their kid got in trouble, or their husband didn't come home, or someone's in jail and they don't know how to get to them, or they need mental health assistance, or someone's in trouble with the law. So there any of those questions and 1,000 others are why people come into family support centers. And what we do is help them connect with resources that exist in the community. But I think even more importantly, we help them establish relationships that help carry them through navigating the system and figuring out what they need to do. We have staff that, aside from English, also speak Spanish, Russian, and Ukrainian, and understand the various cultures and are part of the various communities. So it was really, I can go on forever. But anyway, that's basically what we do. Thank you.
Thanks, Winnie. Who next in line? Pastor Doorway, would it be you probably?
So I have a brief question before I try to explain, and that is, while Mike is representing Journey and I'm from First Pres, Matthew and I met with some people. Is there going to be, and I thought on our, looking ahead on our agenda, I didn't know if you want a faith community response or discussion now or later.
Later.
Okay.
The next meeting is where we're going to be talking more in depth about feeding programs and other crisis interventions, short-term interventions, and support.
Okay.
So today, just sort of just briefly, what kind of support, either outreach services, either do folks come to the church, and we know you're offering
do people
feeding
come
programs.
to church?
I mean service providers, do they come?
Well, part of our entire mission and understanding is that people come to church. Yeah, people come to, I believe, the church I serve and other churches are based upon the fact that they are churches, and people come in our doors often, many times a week, asking for various types of assistance. I can only speak from the First Pres side, is that I try, as the lone pastor, my best with some staff to do our best in referrals, and we try our best. And then on Wednesdays, we do feed anyone who comes into our building at 5:30.
Thank you for hosting the tour. Appreciate that. Mike?
So at the Journey, we do a few things. We began with a Thanksgiving meal. I believe we began that in 2010, and that's gone very well. We receive a lot of people on the night we do that, the week of Thanksgiving. And we also provide blankets and sleeping bags and warm clothing on that night. And then this past year, we made a big jump to hosting and providing a community meal every Saturday evening at 5 p.m. And we have some help from some other people outside of our church as well. So we strive to provide warm hospitality and good food and share the gospel with people. And each Saturday evening, we also provide clothing that's donated, given through donations. And in the colder months, try to provide other things to help with that as well. And then also, we do something on the last Saturday of each month called Diapers and Donuts. And that's just an opportunity to serve families who might be struggling, with the high cost of diapers. And so we have a lot of people donate diapers. We we purchase diapers and we make those available to people on the last Saturday of the month. And then in addition to that, we do once a year a community baby shower. And so we have a tremendous amount of donations of all kinds of baby supplies, all kinds of baby clothing, toys, and we have a kind of a big celebration, and we promote it through various means. And I think we've done it 3 years now, and the participation has increased quite a bit. And that is something that we have a lot of people helping with, and that's been a real joy to be able to serve in that way. So,
thank you, Mike. Appreciate that. Glenn, I don't know if anything's happening at the mall. I just thought I'd ask.
Well, not directly, but we are looking for opportunities for community outreach, and I have to be guarded about that because I've got a number of investors that are watching over our daily activities. However, there are opportunities, and we are looking for them. So,
thank you. Mm-hmm. Mark, Tom, I know you have got things to say about this issue.
Yeah, we have several outreach programs. First to mention is a program referred to as PATH, P-A-T-H. It's a federal grant program to provide outreach to homeless mentally ill. So we have a team of outreach staff that reach out to shelters, feeding programs, anywhere else in the community where a referral may come forward and It's basically engagement work with homeless mentally ill to engage them into services. We are funded by the county to do jail transition outreach. So we outreach to individuals identified at the jail as having mental health issues, and are excited about new activity going on there in terms of improving the process. Heard really good things, by the way, from my staff recently, in order to have a plan in place as people transition out of the jail, those that have mental health issues. Additionally, when, as Bob described, when individuals in crisis or first responders call the care crisis line at VOA, it's the Compass Health staff team that responds. They're master level clinicians. They're available 24 hours a day, 7 days a week. They'll respond at the ER, in the community, wherever that needs to happen. One result of that might be the triage center, which you've heard a lot about, so I don't think I have to go into a lot of detail about that. And then the last program I mentioned is our peer recovery center at the Bailey Center site on 33rd and Broadway. It is a center that's run by certified peer counselors. Those are individuals that have self-disclosed that they are recipients of mental health services. They go through a state certification process, become certified peer counselors. We've got about 120 individuals coming through the recovery center every day. We serve both breakfast and lunch, so we've got a couple hundred meals that we serve every day. And you don't have to be a client of Compass Health or another mental health provider. And so that's also an engagement to homeless mentally ill that need someplace to go during the day off the streets, and they're welcome at our center, and we will again use that as an engagement activity for them.
Great. Okay. Ken, how would you like to add to this discussion?
Well, I was just thinking if I could remember what everybody said, I would know where I could go to a free lunch, a free dinner each night of the week, and I wouldn't have to buy food anymore. That'd be good. So with that said, the county obviously funds a lot of different programs. We don't do a lot of services with county employees. Most of it's contracted out to nonprofits or school districts or other entities. But we do fund outreach services in the schools, in various communities. Some of it's tied to alcohol, drug funding, some of it's tied to mental health funding, some of it may be tied to housing funding or developmental disabilities. I mean, just a variety of activities. But I think you've got a number of the agencies around the table, and they can speak to the details. So.
Everett Gospel Mission. So we are I was going to say the only emergency shelter service in Snohomish County for men, for single men, 18 and above. We provide a day center where people can receive services, referrals. We do clothing, free clothing. We do hygiene items. We do 2 meals that are open to the public, both of lunch and dinner. Breakfast is only for those who are residents the night before. So that was one of the concessions we made to the community around us to begin to assist with some of the traffic around us. We also have intensive case management. We partner probably with everybody in this room to do our services. So we really believe that we don't have to be a place where everything's given at the mission. We like people to remain connected to community because hopefully they won't be residents with us forever. We really do a 3-pronged approach to services. We do a 90-day shelter. So if somebody does not want case management, they can stay for 90 days and then they need to move on and then they can come back in 90 days. So we hope that when they have to leave, that'll encourage them to really go toward change. And then we have a passport program that's a 6-month, can be continued for 6 more months. That's not necessarily dependent on participating in our program, but it could be people who are working, people who are in intensive outpatient treatment. We want to make sure that people stay stably housed so that they can move forward. And then we have a faith-based program that's a spiritual recovery program that we also do. That's a 1.5 years.
Okay, so now I was hoping we could talk more about, and you can just offer out any observations and we'll do these together. Strengths or observations of gaps. And one of the questions I've had is raised by what Ed said, the question about whether the Recovery Cafe would have showers. is Compass Center, do you have showers for people that at the day center, or?
We don't. We have clothes, but not showers.
Clothes, is there?
We have showers.
Do you have showers, Sylvia?
And we have showers.
You have, right, for the juveniles. That's Pastor Dorway?
We have on Wednesday evenings a really wonderful member of the Snohomish County, member of Cascade View Presbyterian Church, Frank Fargo, provides showers for the people in our back alleyway. And he often, he's converted his fifth wheel into 2 showers, and he often stays in our alley up until 8:30, 10 o'clock at night, and allows anyone who is willing to take a shower. And he and his wife take their underwear and clean them and give them clean underwear as well.
That's pretty remarkable. Okay, so I'm just going to let people talk about, we had Bob offering that the 2-in-1 system is, in his perception, is a good strength, directly linking people to mental health counseling and dispatching people on site. So, yes, Ed.
Well, I'm hearing information about places to go, several day centers. I believe that many people are on our streets in downtown because they don't feel like they have good places to go. I know a lot of them go to the library, and that's a big challenge for our community and for the library. So I'm wondering if we could do some mapping of where we have resources in the area that are established to respond to the need for a place to be for individuals who end up on the streets.
Are you speaking to day resources or both day and night?
I'm thinking of day resources, but maybe day and night. But I think for this group to wrestle with what kinds of recommendations and solutions and ideas we have for the future, it would be good to have a map that shows us what we have as a baseline.
All right, well, we can work on that. I think that's an interesting suggestion. Cassie.
I love the map idea. I think that's a really great idea, and it's needed. I think the things that are going well is that the limited providers that do outreach are really trying to coordinate their efforts. Cocoon House has expanded our age range. Although we can only house juveniles, we can do outreach and intensive case management to street-dependent people up through the age of 24.
Okay.
And so young adults can access our drop-in center for showers, laundry, and basic needs. So I think those are things that are going really well. There was a couple other notes I took, just a second. One of the gaps is treatment options specifically for youth and young adults. We know that treatment options are so limited in our community, and Cocoon House has experienced major challenges in getting some of the street-dependent youth off of the streets because of the significant heroin addiction and the risk that they present to our other youth. So we do have addicted kids in our program, but so that's a major gap because sometimes we have nowhere to take these kids after we do outreach, right? So we're doing outreach. We're helping getting their basic needs met. We're working together with other systems like the McKinney-Vento liaisons and the school systems, but we can't actually safely house some of our youth, or they just fall back into addiction because there's not enough resources there. And I just also wanted to take the opportunity to add outreach alone. Outreach is the necessary first step, and it takes time to get people. So we do outreach, and it takes a lot of time to get the trust built in getting these individuals off of the street. Most of the time, as the folks were saying, they did not choose to be here. They have very limited trust in systems. They have no trust in law enforcement. They have no trust in adult service providers, and so we do a really good job of taking time to build the trust, but it takes time and patience in order, and many contacts before we can bring people out of that situation.
That's a good observation. So I think that's some really interesting gaps, because there are some day centers, and as Ed said, there are still lots of folks that are choosing to stay out on the street, and that is their right, but it also can be some challenges for the community. So we'll see what we can do about the mapping. So shortage of beds for kids with detox, sounds like a shortage of places for adults with detox. What other strengths and gaps would folks observe? Ken?
Well, one of the things that I've been talking to Bob Reese at VOA about, and others have also brought it up, is right now VOA has a 24-hour crisis line. That's one phone number. Then they have the 211, which was just 8 to 5 Monday through Friday, but now it's 24/7. Cassie mentioned that Cocoon House has a number that people can call 24/7. In talking to EMS paramedics across the county, as well as law enforcement, either myself or Dr. Finn, our research manager, or other staff, the first responders have told us how frustrating it is that, one, they don't know all the resources, and there's no way they can know them all. And there's no way that they can be carrying around 5 different 24/7 numbers that they're never going to remember. So one of the thoughts is, can we at some point create a culture in this county where we have one simple number that could dispatch Cocoon House or whoever, and that number would be 211. It's easy to remember. First responders are used to 911. 211 would be easy to remember. First responders could call 24/7. Somebody could get dispatched, assuming resources were available. It just makes sense for us to begin those discussions, to talk about, you know, creating efficiencies and creating something that's effective in terms of a response system 24/7.
Can I speak to that just briefly? With youth and young adults, I completely agree with having a one number, and Cocoon House has moved to one number as opposed to like 30 numbers as we used to have. It's challenging when you've got youth and young adults because we have, as a licensed provider and as a national safe place provider, we must respond within 45 minutes. And so if there's any bottleneck or barrier to getting that response time, if 211 and then you got to go through this system or that system, then it might limit our ability to remain a national safe place provider. And I want to also mention another significant gap is funding. You notice that there's very limited adult outreach services. There is no funding for outreach. The county has a couple of pockets of funding for youth services that allow us to do outreach, and we receive some federal dollars, but it's not anywhere near enough to conduct the level of outreach that's needed in this community. And there's absolutely, it's not a priority from the federal government. It's not a priority it's a very hard thing to fund. And so that's why there's not enough happening, because there's no dollars available to do the work.
I'm sorry. Oh, look, there's 3 in a row. I'll start with Renee.
I need some clarification about bathroom facilities. For example, for the feeding programs, are bathrooms provided? And what can we do about public bathrooms in terms of people going to the library, as was mentioned earlier? Where else should we refer people? Just questions like that. I know it's not easy to talk about these kinds of things, but it is an issue as a retailer downtown, so I would like to have that addressed.
I don't know, would either of you like to speak to that?
Sure.
Alan or Mike?
At least for the feeding programs, we have access to bathrooms. On Wednesday nights, we allow any guests to use our restroom facilities, and Journey too.
Likewise, yes.
So at least from the feeding program standpoint, as far as I know, all of those that do feed offer bathrooms. And technically, we would prefer, if people are downtown, if they wanted to use our bathroom, just come into our building rather than pee on our door. So I understand that.
Some common ground there. Okay, Megan. Thank you, Pastor Dorway.
So I was going to piggyback on the map idea that it also includes time of day. So I think location of services is important, but there's also people are released from jail at midnight, and so then they can't find housing. And then if you're in a temporary housing situation, you have to be out, I think, at 10 o'clock. So where are those gaps for services required by policy or funding that you don't want to pay for another night in jail.
Good question. Laura.
So it seems like there's a gap where officers are oftentimes contacting people who are involved in street-level social issues, and there isn't necessarily going to be an arrest, but they would like a place to take them or to tell them where they can go. And maybe our officers should have the ability or discretion to refer them to a social worker, like Seattle cops get to do with the, I think it's the LEAD program, the
Yeah, that's the
Law
program.
Enforcement Assistance Diversion Program. So maybe that could fill that gap. And it's, I don't know if it's really outreach, but officers are oftentimes out on patrol anyway, and they might see these street level social issues or be called to a scene where there isn't necessarily going to be an arrest because there's no crime, but maybe the officer, if they have, you know, are given the ability, are able to refer them to a social worker who can plug them into Cocoon House or to 211 or whatever's already available.
And this goes back to your earlier question about what can you do instead of arraigning people.
Yeah, yeah.
Thank you. Okay. Chief, you want to speak to that?
Well, I do. I was just going to say, Flora, I think that that's a great point and something that we've been talking about in the police department. Again, we talk about funding, but how great would it be to have a social worker in the police car with the officer, with an officer that's working in certain areas of town where we're encountering a lot of these situations. And instead of, you know, handing that individual a piece of paper with a phone number on it saying you need to call this person, actually having the social worker right there, grabbing them right there and making that intervention right at the scene on the street level. And I think that that's something that I'm interested in exploring, something that 10, 20 years ago in law enforcement, I don't think we typically would have been necessarily open to exploring. But today, I think we've reached that point, and it's something worth further consideration.
Thank you, Chief. Sylvia.
So I have two comments. One is about outreach, is that I think outreach is key to the solutions that we're going to go to, but also think having a liaison from the provider community or social services for business folks to call so that they're not always calling the police, because sometimes we could be an intervention because we may know the people and it's not them interacting with a police officer, but it's interacting with one of us. So I think that that would be important. And also the gap is for people who are intoxicated or high but are not committing a crime, where do they go?
So a services liaison.
For the business community. So it's a number or a person that they could call that would then respond.
And what was the other idea? I'm sorry.
Did I have another idea? Okay, I have to think.
If you're intoxicated
Oh,
or high,
intoxicated.
where-
If you're intoxicated or high, where do you go? Where could somebody take you besides the detox beds? So there's not a facility. So the Salvation Army used to, during the cold weather, we had a partnership where they would, if someone was intoxicated or high, they would go to their cold weather shelter and we would swap people. So if somebody became sober, they came to the mission. So we would swap people all night. Because we would not allow people who were intoxicated or high, and they had people up all night
And
doing
that's
that.
closed?
Well, it hasn't been done in a while that they've done the cold weather shelter in that fashion, but that's a big issue. That's a gap.
Okay.
Yeah.
Good. Who else has a thought about gaps or strengths? Tom?
I wondered, on Ed's good idea, whether we should map out whether we shouldn't, in response to Ed's idea, also map out the outreach activity. Because some of these great ideas may already have resources in place that could easily provide some of what we're describing. So if we mapped out who's doing outreach to whom, available when, and then also have the map of where people can go and when they can go there, that might give us a nice picture and lead to some good conversation.
Is there, I'm thinking if I take, 3 or 4 of the city staff back and we try to do this, we do not have all the information. Is there a group that does exist that might be able to assist getting this mapping information accomplished? I don't know if we need to get it done in the next month, but it seems like a really good idea. I'm not sure where it should be housed, so maybe we don't have an answer for that, but we should think about that. Winnie, and then I think Mark. Thanks.
I do think the mapping is a great idea, but I think we should be sure that we overlay it with transit information, transportation, because that's an important factor when you're talking about our homeless community.
Me?
You, sorry.
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 One of my employees has a church that he goes to in Mill Creek, and he participates, I know, in a homeless dinner that his church provides. And a couple of years ago, he brought in a document that was either handed out at their church or was circulated among the churches, which listed all the nights that the various churches throughout the city, and maybe the county also, provided free meals. And I remembered looking at it and thinking, with the number of churches and the nights that they offered, you could practically get a dinner each night if you knew where to go. So I don't know if they still do that.
You guys are doing that, aren't you? Do you guys do that?
So, well, I'm going to pass out. I didn't know if to bring it today or anyhow. This is, and you're right, I guess to respond, on one level, in our community, there is a hot meal every night of the community provided, either primarily by a faith community, Gospel Mission, one of the faith communities around. This is, as of, I think, what month is it now? As of April, the best guess, this is what came to our church. The website that's on there does not work because I looked at it to try to get another one, but occasionally a couple of individuals who are in need in our community update this list, and it shows up at our church and I think at other churches. So I don't know if that helps or if this is a beginning of map. I didn't know if whether to circulate it today or another time, but that is at least the best guess at this time. Some of those change.
So this is primarily meals, or is this also food? I mean, shelter.
Yeah, there's a variety of, there's a front and back.
Yeah. So the front is the meals, the back is also shelter?
I think it's food. It's food.
They're both meals.
Both meals, so Snohomish versus Everett, okay.
Yeah.
Interesting. Okay. Other thoughts about gaps? From the perspective of folks in the business community or residents, are there things that you wish were happening that are not happening? Some that deal with outreach. Are there holes in the services that you wish you were not seeing? Maybe a difficult question.
Question for Sylvia.
Yeah.
What's your capacity of beds, and are those beds always full?
So that's a complicated question because you added the word beds in there. So we have beds, 85 upstairs beds, and then we turn our day center, we use it for mats in the evening, so 50 mats in the evening, 50 plus mats in the evening.
And is
in
it
the day
full?
center.
Is it always
Yes,
full at night?
Yes. Sometimes in the winter, way full.
Other questions? Suggestions? Yeah, Glenn.
If I could just share an experience that I see each year, and it's in Seattle. There's a restaurant called Two Bells. It's on 4th Avenue. And right near it is a women's shelter. Let's see if I can do this without. When I first go there, it's after a motorcycle event, and there's a lineup of women outside the door, mostly with roller bags and other bags. So it's a place that has a number of beds. As I'm eating, I see a number of women with a blanket under their arm walking by every night.
So you're thinking that's telling you that there's not enough beds for the women in the shelter?
Right.
Right. So do we know for shelter providers, do we know we're definitely short on capacity?
Absolutely.
Is it both genders? Is it women and men?
Absolutely. Families, single women, men, shortage.
Everybody?
Absolutely. Absolutely.
Cassie had to leave, okay. All right, well, gap, shelter. Okay.
Some of the, sorry.
Thank you.
Some of the concerns I've heard from members in the business community
Mm-hmm.
downtown, there is a concern about the feeding programs
Mm-hmm.
and concentration of feeding programs
Mm-hmm.
downtown, and the fact that it is drawing people in who are in need of other services.
Mm-hmm.
So there is a gap where they're not getting those services, not getting housing,
Mm-hmm.
and the spillover impact is that it's affecting neighborhoods and businesses that have, people camping out their doorways. You have to clean up a lot of messes, and so it's affecting their businesses too. And so I guess one of the questions that I'm wrestling with personally is concentration equals convenience for people in need, but at the same time, it's creating some serious challenges for residents and businesses who are in the area where these services are being provided.
Okay. Well, we were going to have a chance to take that up, I think, a little bit more at the next meeting, and it's a good issue, and it was one that was raised by several folks in the homework issue. So, thank you for putting that back on the table, Alan.
I'm, as much as I would like to talk to that, I think there's a better time to do that.
Yes. Thank you.
But I do have a quick, for me, a gap at least as a faith community pastor is that when, I don't know if this is a significant gap, but there seems to be a gap in like emergency rental help. And I know that a lot of our service providers are doing that, but I cannot tell you, once a week I have someone come into my office, and I know that they've probably, based upon my conversations with an individual, they have definitely waited to the 11th, 59th hour, and I don't know where those resources are.
Does anybody know? Do we have any program for rent assistance?
There are a number of those, but the problem is that many of the emergency vouchers are not, you can't access them 24/7. You can usually only access them Monday through Friday, 8 to 5, and only if you meet the criteria, because each fund source has a different restriction. So it's very, very complicated. I mean, the reality is things like emergency vouchers, shelters, those are all Band-Aids. They're not the solution. They're Band-Aids that we put in place because we aren't dealing with the solution. The solution is finding places for folks to live, not just to stay overnight, or stay 2 nights, or stay 3 nights. So somehow we have to figure out how we are going to work within our community to find places for people to live, not just for them to be at that moment. Most shelters let people sleep in there overnight and send them on their way during the daytime, which means then they're going to be back in the doorways or other places for that time period while those folks are trying to figure out, where do I go, what do I do? So I think at some point our discussion has to be about, we've got great Band-Aids. Not enough, but we've got great Band-Aids. When are we going to get to the next level so we don't need the Band-Aids anymore?
You may still always need to be, I mean, I think we're structuring this discussion so we start with the outreach, and then we're going to move to the sort of the short-term Band-Aids, and then the long-term housing, and it may be getting somebody into the lifeboat, getting them across the ocean, and then putting them on dry land.
That was a rhetorical question.
Yeah,
you didn't need to answer it.
Got it.
We're going to get there, I know.
Okay, thank you.
In terms of the discussion.
I don't know what the answers are, but we're going to at least try to talk about them. So we will be doing that, and that'll be the focus of the discussions at the next meeting, which is probably a good segue to let you all get out of here. But I wanted to ask before we do that, if folks would like to, if there's a handful of you that would like to work together to think about these outreach issues, maybe propose a home or a way to get some of this mapping done, that could be one of your recommendations. You know, we may not be able to do the map as a task force, but maybe one of your recommendations could be to put your heads together about what's the best way to get that mapping done and how to utilize that information. Is there anyone that'd be interested in working on that type of an issue? Pastor Dorway, thank you. Anyone want to join him? And we will get you staff support. It may be Wendy from the back there with Neighborhood Services. I think I'm going to maybe volunteer the chief to work with you as well. Facilitator's prerogative. I won't use it too often because I know you have a gun. Okay. Anybody else have an interest in working on some of the outreach issues and where the gaps? And we had a lot of really good suggestions here today. Well, we might find another volunteer out in the community, so you might get a call from me. But thank you, Pastor Dorway, and thank you, Chief Templeman, for being volunteered by me so rudely. Okay.
I was just about to raise my hand.
Oh, you're good. He rocks. Okay. And again, before you leave, so I think that's all I had for today. We've talked about what we're going to talk about next time. I will send you an email about additional follow-up questions you may have around this criminal justice discussion that we had earlier today. The minutes will contain, again, the write-up of this discussion here, so we'll be keeping that record of ideas as we're going along. And please, I think only about 8 of you have signed up for a tour. Some of you, bless you, have signed up for multiple tours. But we would really like all 23 people to attend at least one tour, preferably go somewhere you haven't been before. So please do that on your way out today. Please also leave me your comment cards either on the table about what we should be thinking about asking folks at the focus group later in September. Fill this one out, give us your ideas. Thank you, Glenn. I see one. Anybody else? Really would love to get the ideas here. I think that's it, unless there's anything else I'm missing. So thank you very much, and we will see you in 2 weeks.